Dear students, welcome to R.A.T.S, Racing Against Time for Students in Pathology. I am starting with a new chapter, namely the metabolic and the environmental diseases. Let's start the class with a case study. A middle-aged male, newly transferred bank employee, was brought to the hospital OPD in a semi-conscious state. There was no history of trauma, and he was subsequently admitted to the medical ICU. His vital signs were as given below. On systemic examination, all the systems were found to be normal, and the patient was responding to deep pain. His words were incoherent. I hope you people would make a short list of the diagnosis. On general examination, there was no pallor, no icterus, no clubbing, no edema, and the texture of the skin was normal. Make a list of your differentials and what should be the immediate panel of investigations. The differentials that I would prefer will be diabetes mellitus, malingering. Sometimes the patient pretends, that is called as malingering. Poisoning, we do not know. Hypoglycemia, electrolyte imbalance, hypocalcemia, alcohol intake, epilepsy. The random blood sugar of this patient was 330 milligrams per deciliter. I hope you have come to the diagnosis. Diabetes mellitus. The importance of this topic is given in the enclosure. Think of the subheadings. The subheadings will take you to the answer. And I would like this topic to be dealt with under these headings, which you students should not miss. The name diabetes mellitus refers to these symptoms. Diabetes, from the Greek word diabenin, meaning to pass through. The patient always has a history of copious urination, and mellitus, from the Latin word which means sweetened with honey. There are different ways of defining it. One book says that diabetes mellitus is a syndrome of impaired carbohydrate, fat, and protein metabolism caused by the lack of insulin or a decreased sensitivity of the tissues to insulin. This is one way of defining. And another definition is it is commonly referred to as diabetes and is a chronic disease caused by inherited or acquired deficiency in the production of insulin by the pancreas or by the ineffectiveness of the insulin produced. So I hope that you people are able to identify the two pictures on the screen. Paul Langerhans. What I would like you people to note is, look at the lifespan of this individual, a German pathologist and a physiologist, Paul Langerhans, who worked under Rudolf Virchow, the father of pathology. And within a short time, 40 years is not a very big age, he developed tuberculosis and succumbed to the disease. And he was the person who identified this, the islet cells of Langerhans. So this is a schematic picture of the pancreas. The pancreas is over here, and I'm able to see the pancreatic acini. These are the exocrine components of the pancreas, and this is a small group of cells called the islet cells, which can be Langerhans cells or the beta cells. Beta cells as well as the alpha cells. There are two types of cells. In addition to it, there is another cell called the delta cell. Now, what are the causes for diabetes? It can be divided into genetic defects in the beta cells, genetic defects in insulin processing. The first one has got MODY, maturity onset diabetes in the young, and mitochondrial DNA mutation. Under the insulin processing, you have got defects in pro-insulin conversion, insulin gene mutation, insulin receptor mutation. And there is another condition called gestational diabetes. This particular picture is just to show that there can be immunological, that is autoantibodies against any of these, either the receptors or the islet cells, etc. Then there can be genetic factors. Finally, there can be viruses. All of this can lead to type 1 diabetes. Causes continued, I have got something called as exocrine pancreatic defects. Chronic pancreatitis, pancreatectomy, hemochromatosis, cystic fibrosis. These are all some conditions which we may or may not be familiar with, but they can cause diabetes. There can also be a group of endocrine disorders such as Cushing syndrome, glucagonoma, hyper or hypothyroidism. Infections such as cytomegalovirus and drugs such as glucocorticoids, thyroid hormone or statin. I do not know how comfortable you people are with the list of causes. So I have just provided you with a stupid mnemonic, MEDIC, and the number is given below. All are true, last one G is 3. Let us see what is there on the screen. M for MODY, M for mitochondrial DNA mutation, E endocrine defects, exocrine pancreatic defects, D drugs which can be antithyroid or statin, I infection, Coxsackie virus, cytomegalovirus, G genetic, B cell dysfunction, insulin gene or receptor dysfunction, gestational. I hope this will be a little more easier, though it is not very logical. We people shall follow this for the causes of diabetes. Another one that I felt was good enough was always there is a kind of a balance between insulin and glucagon. Both are being provided by the pancreas. The insulin will lead to increased glucose oxidation, glycogen synthesis, fat synthesis, and protein synthesis. All are being increased. Whereas glucagon leads to glycogenolysis and gluconeogenesis, the opposite effects of insulin. Somewhere there has to be a balance between the two. And this is just a diagrammatic one. You people can draw this picture if you need. The pancreas is over here and there's a normal islet cells. And the beta cells are being destroyed. So all the blue color is supposed to be the beta cells. They are being destroyed in a case of type 1 diabetes. A simple fundamental concept we people should be having in mind. Normally you find that a healthy pancreas produces adequate amount of insulin. This acts upon the insulin receptor within the cell and the glucose gets metabolized. This is normal. But what happens in type 1 is it can be because of antibody, etc. There is a decreased amount of production of insulin or there can be a failure. Therefore, you will not be finding adequate amount of metabolism. The glucose gets accumulated. In type 2, on the contrary, insulin is produced in adequate amounts, but there is a failure in the receptor. So once there is no attachment to the receptor, there is no further signaling or metabolism. That is the basic difference between type 1 and type 2 diabetes. No insulin, adequate insulin. Receptor is present, receptor is absent. This is the homeostasis of the glucose metabolism. You find that there is the two pathways can be seen in this. One in which you find that there is an adequate amount of insulin and therefore it is taken up by the look at this picture carefully. It is a simple diagram. There are two halves of it, one the upper half and another the lower half. In one, you find that the blood glucose level rises and there is the production of insulin by means of the beta cells. The insulin is being released and the liver takes up the glucose. There is a metabolism and it is stored. The body cells take up the glucose. As a result of which you find that the blood glucose level decreases. So this continues on one half. On the other half, you find that there is a decrease in the blood glucose level. And you find instead of the beta cells, the alpha cells producing glucagon are active. Glucagon is being released and there is a breakdown of the glycogen that is already stored and there is a release of glucose. The blood glucose level rises and there is a homeostasis. In one, there is a production and a utilization. In another, you find that there is a defect and a synthesis from another site. So both these you people should remember and explain. Again, a simple conceptual one. I would like you people to understand the difference between type 1 and type 2, which you have already mentioned. Type 1, there is no insulin that is being produced and there is adequate amount of receptors, there is no blockage, but the patient develops a diabetes because there is no insulin. In the second one, you find that there is a defect in the receptors, as a result of which you find though insulin is being produced, it does not respond. The patient develops a diabetes. The cells do not absorb glucose. So no insulin, no response. These are the two keys for it. Types of diabetes. One can be type 1 or insulin dependent diabetes mellitus. The pancreas fails to produce enough insulin. It is an autoimmune disorder. Type 2, it was earlier called as non-insulin dependent diabetes mellitus or adult onset diabetes mellitus. And the third type, the major type can be gestational diabetes. So remember these three things, you will know why. Because what are the basic differences between type 1 and type 2 diabetes mellitus? Though it is not important per se, but if diabetes is asked as a question, definitely this tabular column should come in. All the differences are mentioned over here. The salient points alone I shall highlight. You find type 1 diabetes occurs in childhood and it is linked to HLA, human leukocyte antigen. Pathogenesis is because of autoimmunity and the blood glucose level is decreased. There is a decrease in the insulin cell. Patient may develop ketoacidosis. So these are some of the key points, you people can note it down. Type 2 diabetes more common, occurs in the middle age. There is no association with the HLA. There is no genetic locus in type 1, whereas in type 2 it is located in chromosome number 6. There is resistance to insulin. And you find that there can be a hyperosmolar coma. Here there is a ketoacidosis. These are the major things I would like you people to kindly by heart. Yes, students. What are we seeing on the screen? Okay. In the next class, we shall be seeing the complications and the organ changes in diabetes along with the laboratory investigations.